8 o'clock, and it's time for the Lasco Microfinance Business Minute. Let me remind you, if you are a small or medium-sized business owner looking to grow, expand, or just need a financial boost, this is the feature for you. Each week, we explore smart loan options and solutions, and they're all designed with you in mind. And we're going to get right into it. Just let me remind you that this is all courtesy of Lasco Microfinance Ltd. Loans made easy. This morning we have two guests, and the focus is pretty much on the importance of proactive healthcare and, in fact, funding for medical emergencies. Joining me, as usual, Anne-Marie Francis, who is Regional Sales Manager with Lasco Microfinance. Good morning, Ms. Francis. How are you doing today?
Good morning, Richard and listeners. I'm doing great this morning.
I'm glad to hear that. Always a pleasure to have you on with us. And a first-timer to this segment of the program is Professor Marvin Reid, who is our guest. He's the president of the Medical Association of Jamaica, and we're very, very pleased to have Professor Marvin Reid with us this morning. Good morning, Prof. How are you doing?
Good morning, sir. I'm good. Just a slight correction. I'm not yet the president. The president is Dr. Leslie Mead. I assume presidency in September, so I'm the president-elect.
Okay. Thanks for that correction, Professor Reid. Great having you. And I want to start with you, Prof. If you will, could you give the listeners sort of a brief overview of the MAJ?
Sure. So the Medical Association of Jamaica is the oldest professional organization of its kind in Jamaica. We were started back 60 years ago almost as the organization. We were formerly part of the British Medical Association, and we received our independence, so to speak, back in 1966. 65, yeah. So we are an organization of medical doctors, and our mission really is to enhance the professional and personal development of our members. Mm-hmm. But in doing that, our main goal is really to allow individuals within the country to achieve optimal health and wellness so that they can be relevant to their society as well as to their self and family.
Mm-hmm. What's the size of your membership at this time, Prof?
Currently, we have close to about 1,500 active members.
Mm-hmm.
The total number of registered doctors, which represents roughly about 50 to 60% of the registered doctors within Jamaica at this time.
Okay. And what would you say are some of the financial challenges that you find members of your association speaking about or facing from time to time?
Sure. So as doctors, we live within a society. So the similar challenges that the society in general faces are the same challenges that we face, both personally and those of us who operate businesses. So for clarity, probably about half our membership work within the public sector. So this is your health centers, your hospitals, and so on. Mm-hmm. And the other half works in the private sector and therefore operate businesses and enterprises. So let's start with the private sector component. And some of us work both in it, both public and private. So if you look at the private sector, mm-hmm. the main challenges are, as I said, any challenge that a business would operate. So we work within the legal framework.
Yes.
One of the big issues that has just emerged is this whole issue of how do we become compliant with the Jamaica Data Protection Act that has recently been passed. Mm-hmm. We also face issue with access to financing, affordable financing, so that we could invest in equipment and so on, and as well as we, the various regulations as it relates to the taxes and so on are things that any small business or medium to large business we all face. Within the public sector, many of our members will report, as with most public sector employees, that they are not satisfied with the level of compensation that they receive from our employers, which is the government. And from time to time, you may hear members becoming quite agitated and sometimes may resort to withdrawal of services. Outside of that, the other issues is the working conditions and the conditions of employment. They often report that sometimes they may not have the necessary equipment to offer the kind of service that they would wish to have, as well as the fact that the hours that they're required to work is proven to be long and stressful. And more recently, just like any other member within the society, a big concern is really the issue of security. You may have heard of incidents of doctors and nurses and other health professions facing assaults and so on at their place of work. So those are some of the big issues that the members often report on.
And Prof, I want to thank you for highlighting them. I'm sorry, here with us this morning. And on the matter of financial challenges that your members might be facing from time to time, before I give Anne-Marie Francis the opportunity to address those, I wanted to ask you finally here, Prof, how does the MAJ members assist both parents and schools in preparing for the back-to-school period?
Oh, sure. So I would have liked to take a step back to say that I think many of us accept, certainly from their experiences with COVID and chikungunya, that having good health or being good health is an important individual attribute, something that you should all aim for individually. But collectively as a society, the fact is that the populations in general need to be in good health so that there's good productivity and we can all enjoy a better quality of life. Having said that, there are several strategies that one can engage in to ensure that one achieves these good health things. And one of the strategies is really to have what we call health maintenance checks or health maintenance visits. And what are these checks? These checks are essentially where people visit their health professionals, their doctors and so on, just to ensure, just to have a checkup, just to make sure that things are going well. Because you want to identify problems before they become really bad and then become very, very expensive. And so within that context, what the ministry has insisted, as the Ministry of Education, is that school children who are going to school should have a health check. And so this is an important activity. Some parents may see it as a burden, but in truth and in fact, it's actually a blessing. It's a way to ensure that your child is screened for major issues before they actually become a big problem. So as health professionals, as doctors, we do participate in trying to ensure that we provide the service that the parents and the children will need. Some of us will do this by having discounts for school medicals at our individual practices, those of us who work in the private sector. Some of us go as far as volunteering with community groups, whether it be churches, whether it be service organizations like the Rotary or Kiwanis and so on, and all for health fairs. We're in the midst of silly season. Silly season for me is election season. So some of us even volunteer with the members of parliament and potential members of parliament to on their health fair that they may have. And we anticipate that we're going to get quite a bit of call on our membership during this summer because of the silly season to provide these kinds of services. Outside of that, we all know that Jamaica does a no user fee for health centers, and therefore at the health centers, individuals can actually access these medical services without paying an out-of-pocket cost. The other thing that we use these health maintenance visits to do is to look at things like, apart from screening for things like hypertension and diabetes and heart problems that may occur in the children, we also use this opportunity to ensure that the immunization status of our children are up to date. We know nowadays that there's some concern about vaccines and what vaccines cause, but we know that vaccines have been an important contributor to the fact that we enjoy good health and we are free from certain kinds of diseases. We
Yes.
see what is happening in the U.S. with their measles outbreak. And so one of the things that we do is check their immunization status and ensure that it is up to date to ensure that our children and our society is not afflicted by preventable infectious-related diseases. So that's how our members contribute
Yes.
to this back-to-school effort.
So many ways, and we just want to publicly commend you and every member of the MAJ for the fine work you have been doing through the years at keeping the nation healthy. Thank you, Prof. We appreciate that.
Thank you so much. Okay.
Now, before you go, Prof, I know that while you've been talking, Anne-Marie Francis, the regional sales manager of Lasco Microfinance Ltd, she's been thinking, and I'm sure, Anne-Marie, that one word, solutions, is what is you're looking at. So first of all, you heard Prof talk about the back-to-school preparations and so on. Let me ask you to remind us this morning, Anne-Marie, if you will, about the current back-to-school promotion that's going on with Lasco Microfinance Ltd.
Okay. Our back to school promotion is designed to help families and small business owners meet seasonal expenses with less stress. Now we have 9 branches island-wide. We're giving, for our back to school, we're giving up to 30% off processing fee. Our loans for personal use and also businesses. Professor Reid stated that half of the MAJ members are within the public sector and half within the private sector. Now we have discount rates for the public sectors and also for the private persons. We also, once you want equipment for your businesses, we will lend you that money. And not only we will lend you, our CROs will also come to you. He also stated that the doctors are giving discounts. And this is for the parents who are out there listening also. You can get your personal loan at all our branches island-wide. You can reach us at 948-1224, or you can call me directly at 822-4312. And my name is Anne-Marie Francis, as Richie stated.
All right, so that's interesting stuff. Prof might want to know also what's the range in terms of, like how much money can even members of his association get to borrow?
Okay, and I'm glad you mentioned that. They can get from 100,000 up to 10 million. So the doctors are able to purchase their equipment to perform their duties and all the work that they have to do.
Up to $10 million. How does that sound, Prof?
That sounds like a good start.
Yes. It's something that no doubt will get some consideration from some of your members. Up to $10 million in one loan from this company. And we definitely hope that they'll see the need to capitalize if they have that need. Prof?
Sure. Any mickle muckle, as I'm told. So,
yes.
So yes.
Absolutely. Any last words for us this morning, Anne-Marie? You've said you've given us good information that I'm sure the MHA and parents can utilize. What else you want to tell us before you go?
Apply today and make the most of Lasco Microfinance summer and back to school preparation with confidence.
All right. Thank you so much, Anne-Marie Francis. And Professor Reid, I thank you also for coming on and sharing such wonderful insights with us.
Richard, just
yes.
want to mention that the week of November 25th is our Founders Week.
Yes.
And this year we'll be celebrating our 60th anniversary as an organization. So during that week, we'll be having a series of activities. So this has served as a save the date to say that during our Founders Week, we'll be having a series of activities to honor our past presidents and our current president, and really to highlight the role of the MAJ in society.
Thank you for that, Professor, and I wish you all the best when you take on the mantle as president. You are now president-elect, but soon will become president, and I wish you all the best. And whatever we can do to assist you during your term, please call on us anytime.
Thank you so much.
All right, appreciate it. Have a good day, and thank you, Anne-Marie. Have a good one as well.